Why do vaccine fertility myths persist? And how can you confidently tell fact from fiction? And what is the guidance for pregnant or breastfeeding women when it comes to getting a COVID vaccine? Hello and welcome to the latest edition of Coronavirus, What You Need to Know. I'm ITV News presenter Faye Barker, and I'm joined by Dr. Raj Mathur, who chairs the British Fertility Society, alongside his role as a consultant in reproductive medicine at St Mary's Hospital in Manchester. So very well qualified to discuss all things fertility. Hi Raj, welcome to the podcast.
Hello, thank you for having me.
Now, before we get to you myth-busting for us, do just tell me, you must have fielded so many questions about the impact of the vaccine since the rollout began in December. So have concerns over fertility been among them?
They certainly have. Fertility has figured very prominently in the questions people have asked us about the vaccine, and it's been right from the start. I think when the vaccines were rolled out, there was quite a lot of, I have to call it, misinformation out there on social media, and that led to a lot of people having quite genuine worries about it. And you know, people are not alone if they have concerns. Some of my medical friends and nursing friends have also had the same concerns to begin with.
So we'll take a look at some of those myths in a bit more detail, or misinformation, as you say. But doctors have generally repeatedly said, haven't they, that the COVID vaccines are safe for pregnant women, breastfeeding women, and also those who are trying to get pregnant. But yet when it comes to things like clinical health trials, pregnant women are generally excluded. So why would you say medics are confident enough to advise that it is safe to get the vaccine?
You're absolutely right that when the big trials on the vaccines were done, they excluded pregnant women. That goes back to the history of medical research, and we've always treated pregnant women as a slightly different case. But after the vaccines were introduced, we realized that there was no reason to exclude pregnant women. And since then, pregnant women have been included in the vaccine program, particularly in the United States, where there are now several thousand pregnant women that have received the vaccine. And they've got a program called vSafe, where the patients get an app in which they enter their health status after receiving the vaccine. So now the results from vSafe have been published, and it shows that pregnant women who received the vaccine did not have a higher rate of any of the problems that we might have otherwise expected. So they're just as likely to have a good outcome to their pregnancy as they would have been had they not received the vaccine.
So some women in their early 20s that I've spoken to, they may not be planning a family right now, but they do have concerns that something negative may come out in, say, 10 years' time that we just simply don't know about now. And perhaps with these trials that have happened, they just haven't had time to really see any very long-term effects. So how can you reassure people who are perhaps in that position and they're worried about that sort of something coming out, say, in 10 years' time?
Okay, so the first thing to say is that for us to worry about those things, there needs to be some kind of plausible link. And so far, there has been no kind of biologically possible way in which the vaccine might harm fertility. The second thing to say is that we're now beginning to get actual facts and data as well from people who've had the vaccine. For instance, there's a study from Texas now where men who were going to have the vaccine were asked to do a sperm test before they had the vaccine. Then they completed their vaccination course, came back for a sperm test. Absolutely no difference in their sperm test results. So we think that it's not affected the sperm at all. Similarly, there is now a research study out in which women had an IVF treatment cycle, stopped IVF, had the vaccine, and then came back for a second cycle. And again, we find that their second cycle of IVF, they didn't do any worse than the first cycle. And in fact, some of them conceived in the second cycle. We're beginning to get this kind of data now, which shows us that the vaccine is very unlikely to affect fertility in either men or in women. Now, look, what will happen in 10 years? You'll have to wait 10 years to find out. But at the moment, it's looking pretty good.
That is reassuring, isn't it? But I suppose where we haven't known earlier on in the vaccine rollout, it's given chance for these conspiracy theories to thrive, hasn't it? So I just wondered, could you settle some of these claims that we sometimes see on social media? I'm sure you've heard them before, but let's see. So there's one that's been popularly shared. It states that getting a vaccine could cause a woman's body to fight a spike protein that's involved in the growth and attachment of the placenta during pregnancy. So is that possible?
Okay, now that I'm glad you brought that up, because that was one of the first sort of pseudoscientific myths that came about, and actually some previously reputable scientists got involved in that as well. Now, Here's some facts. The virus has a spike protein. If you get infected with COVID, you make antibodies against that. So if antibodies against the spike protein were going to cause a miscarriage, then a COVID infection would cause people to miscarry, and that doesn't happen. So COVID doesn't cause miscarriage. Also, when you look at the actual spike protein on the virus, the thinking was that it would be very similar to a protein produced in the human placenta. And that was why people were making that connection. But when scientists have looked more closely at those two proteins, they're actually not that similar. So the fundamental reason why people were worried about it to begin with isn't correct now. That's been disproved by looking at the proteins more closely. And finally, more recently, there is a study as well from California this time, where they've looked at the spike protein antibody in women and who are having what's called frozen embryo transfer treatment. Now, this is a specialized form of IVF where the frozen embryos are warmed up and transferred to the woman. And they found very clearly that patients who had a spike protein antibody had the same chance of pregnancy as patients who didn't. So in other words, we can set that myth completely to rest.
That's good to hear. Now, we've got another one here for you. Claims that vaccinated people, this might link to what we've just said actually, vaccinated people are shedding spike proteins, which can affect women's menstrual cycles. What about that one?
I don't think there's any evidence that vaccinated people shed spike protein. We know that women who receive the vaccine can have a brief irregularity in their menstrual periods. That's pretty well seems to be the case. And that's because it's a very powerful immunological medication. You know, we wouldn't be using it if it didn't have an immune effect. Now, in the ovary, where there are hormone producing cells, there are also immune cells. So a transient or a kind of temporary effect leading to a surge of hormones or some other reason causing bleeding is not that unexpected. And by the way, the same thing happens with lots of other vaccines. So women who receive, for instance, the rubella vaccine can have an odd irregular period. Nobody ever worries about their fertility. Just because this is a new vaccine, I think people are focused a bit on that.
That's really interesting because as we were just talking about it, I've just remembered, I'm still waiting for my second jab actually, I've got it in a few days, but after I had my first one, I did have a little bit of a weird thing going on and I thought, this is odd, what's going on here? And I did the classic thing I think people do, I Googled it and then of course I found other people were having this. But I mean, I guess I've got 3 children, I'm sort of not worried about my fertility. I was just thinking I'm at a different stage. I was thinking, is this some weird perimenopausal thing for me? But that's another discussion for another day.
You're quite right. The menstrual disturbance does happen and it can be anxiety inducing for people, but people, it's been looked at and it's not something that will last or have any long-term consequences.
Okay, that's good to know. So another popular claim I've got for you, this one's a bit more way out there, but I think it's been around there. This one is that even being near vaccinated people could have adverse side effects for women. Now, is that just completely bonkers or what's that about?
I don't want to use a word like bonkers.
Sorry, that's me bringing it down.
But it does seem to be a little bit science fiction, doesn't it? I mean, I can't think of a way how that would be the case.
I mean, there's no evidence of any vaccine, as far as I know, is there, where by being near somebody else?
It's completely implausible.
Okay, well, we'll leave that one for science fiction then, won't we? So this kind of misinformation, it is widely dismissed in news stories online. I mean, people like my colleague who is our science editor, when I was talking to him about this, he just said, oh, it's all fake news. And it's great hearing someone who knows about it saying that. But actually, because these claims are shared between people and your friends and family, perhaps on social platforms, people do really take these warnings quite seriously. So what would you say can be done to combat it, to just dispel these myths?
Yeah, so I think the first thing to say is that I don't want to sound as if I'm belittling people for the fears that they have. And I think it's perfectly natural to have concerns about a new medication. It's also perfectly natural to worry about your fertility and what you put into your body when you're planning for a baby, or in fact, when you're pregnant. And as a fertility doctor, as a doctor who looks after women in early pregnancy, I would tell my patients to always be careful not to take a medication unless they really, really need it. At the same time, we know that there's no scientific reason why these effects, which people worry about, would happen. And I think that's quite important. And also, the reason why the vaccine has been brought in is because there is a real clear and present danger. Now, if you're pregnant and you catch COVID, it's more likely to be severe. you're more likely to end up in intensive care, and your baby is more likely to be born preterm. Now, those are real problems. And given that there's no good scientific reason to worry, I think those real problems, which can be prevented by the vaccine, should figure more heavily, I think, in our thinking.
So for someone, say, listening to this podcast now, where would you suggest they go to look for verified data after maybe seeing some of these claims? Where's the best place for them to go?
I would recommend the Royal College of Obstetricians and Gynecologists. That's a bit of a mouthful, but the RCOG website. If you just Google RCOG coronavirus information, they have oodles of information about the vaccine, about the effects of the virus itself, about what type of vaccine is likely to be offered and so on. It's really fantastic resource, which they keep updating as well. So that's a good place to go.
Okay, that's good info there. Now, definitely what you need to know. Now, one interesting thing, if we sort of turn this on its head a bit, can the vaccines have any impact on fertility? So if not hinder, maybe help it, or would that be completely unrelated?
I don't know is the answer to that, and they're not designed to help fertility. So I think it's very unlikely that they're going to improve people's fertility.
Okay. Now, the other thing that would be good to talk about is thinking about the people who have been trying for a baby during the pandemic. We know there have been delays to IVF treatments, and it's meant, tragically, some couples have missed out on their windows. And I know the pandemic has meant fertility treatment it was suspended for 2 months in 2020. So because of all these complications, are you currently working through a backlog from that?
So several clinics, particularly those dealing with NHS patients, do have a bit of a backlog because, as you said, we were closed by the HFEA, the authority that controls clinics, actually shut clinics down. And then when clinics reopened, there was a lag period because you're not able to see as many patients and treat as many patients as you were before because of COVID restrictions. A number of our staff have been ill and so on. So for all those reasons, so yes, we are dealing with the backlog. I would say that particularly if you are worried about missing the chance of IVF treatment because of age factors, then I would speak to your clinic and ask them to speak to your CCG, which is the NHS commissioners who pay for the IVF treatment. Because what we've seen is that quite often the CCGs are quite understanding because they realize that this is not for any fault of the clinic or fault of the patient. This is an act of God, as it were. And they're quite often they're understanding and may allow your funding to continue a bit longer. So I would say speak to your clinic.
That sounds really reassuring. That's like some hope for people who maybe feel they're in that position that they might have missed out. I mean, obviously there's been the mental health stress along with financial impacts on people who've been waiting. Anyone who's after sort of medical help to have a baby. I mean, how hard has it been really through this pandemic for some of the people you're seeing all the time?
It's been really hard. Together with some colleagues in Cardiff University, we did a survey of patients. We found that they were quite severely affected, particularly with the loss of control. You can't argue your way out of it or persuade your way or buy your way out of it. It completely has caused a loss of control among our patients, and that has affected them badly. And we realized early on during the pandemic that even if we weren't able to do IVF for a patient or a couple, we were still able to talk to them and at least give them some degree of support. So I hope clinics are doing that. For patients who are out there, they should be.
And I think, we're at a time now in this whole pandemic, I think things are hopefully starting up again and hopefully getting back to some kind of normality, would you say?
I think so. I think we are not back up to the same numbers, but I think nationwide we're doing 70-80% of what we would have been doing in a normal year. And that's not bad considering the fact that it had completely stopped a few months ago.
Absolutely. Well, Raj, thank you so much for all of that information and attacking those myths for us and giving us so much brilliant information. We do really appreciate that. Thank you. So that was Dr. Raj Mathur. He's the chair of the British Fertility Society and a consultant in reproductive medicine. So very well qualified to talk to us on all of these things. Now, you can hear plenty more podcasts on a range of health, work and life concerns in this series. And just head to itv.com/news for the latest news on the pandemic. And as always, thank you for listening.